This video is part of the Alberta Healthy Living Program video series, helping you feel better after COVID-19. This video will talk about fatigue and tips on getting back into a routine. If you have had COVID-19, you may not have the same energy levels as before. Fatigue is a common symptom with post-COVID and can persist for some time after infection. Fatigue can be mild, where someone can complete most of their day-to-day activities, but it can also be considered moderate or even severe. Regardless of the severity of your fatigue, most people benefit from using self-management strategies to maximize the energy they do have, and also to help avoid making fatigue worse. COVID-related fatigue can be described as a feeling of weariness, tiredness, or lack of energy. It can be physical, emotional, or cognitive, which means it affects our thinking skills. It can also affect the motivation we feel to get things done. Fatigue can be ongoing or can come and go, but gradually should improve over time. If your energy levels are not improving or are getting worse, it's important to discuss this with your healthcare provider. All activities we do require energy, and some of our basic daily activities may prove tiring after COVID. It is important to try to start doing things as soon as you are able. The longer you stay in bed, the more strength and fitness you'll lose, and the longer it will take to get it back. Start by adding basic activities back into your day. This will help you recover. Go at your own pace and take your time, but don't push through your symptoms. Try to do what you can and add on as you can tolerate. Remember, if you are struggling to get your basic tasks done, it will be too early to think about adding much more to your day. Basic routines include things like washing your face, brushing your teeth, getting dressed in the morning and putting on pajamas at bedtime, going to the kitchen for meals even if you aren't doing the cooking yet. We may need to find ways to spend the least amount of energy, and tools can help. Some tools may help us engage in our day-to-day tasks and routines and reduce the energy we spend. Tools should fit you and help with the task you are doing. Some examples are tools for grooming and dressing, tools for our daily chores, tools for getting around. Many communities have programs that let you borrow equipment for a short time. Ask your healthcare provider about how to borrow equipment short-term if you think you might need it. We need to budget our energy and not overspend when we are recovering, and we want to have enough energy to get through the day. Just like money, it's important to know how much energy you have so you don't overspend and go into overdraft. Remember that tasks that require thinking skills can be just as fatiguing as those that take more physical energy. Understanding your energy budget and the cost of individual activities can help you to plan to spend wisely and avoid making your symptoms worse. There are strategies that can help with maximizing energy each day. Please watch the video Strategies to Help Manage Post-COVID-19 Fatigue to learn more about how to maximize your energy. We also need to make deposits to our energy budget. You can make deposits through restorative activities like quality rest, deep breathing, and relaxation activities. It is important to take care of your health and manage other aspects of your life that may contribute to your fatigue, such as getting good sleep, eating well, and looking after mental health. Make sure you are pacing your activities as best as you can and not pushing through. You may need to take regular planned rest breaks. It's important to do what you can within the limits of your energy. It is also important to rest on a regular basis before you feel your fatigue increasing. If you've done activities and pushed through fatigue to finish them, it's going to take much more time to recover than resting for short periods throughout the task. Remember to be patient and kind to yourself. Take it day by day and seek support if you are struggling. For more information on this topic and others, here's a list of resources for anyone in Alberta to access online, as well as the contact number for the Rehabilitation Advice Line.